The video opens with a dramatic close-up of a large blackhead located on the cheek. The extractor tool is gently pressed against the skin, and the plug begins to rise slowly from the pore. On the split screen, Dr. Jamie Lee appears calm and observant, prepared to walk viewers through the science and sensation of this extraction. Dr. Jamie Lee begins her commentary by noting the size and structure of the blackhead. It is a classic open comedone, characterized by a darkened tip due to oxidation. The plug, composed of oil, dead skin cells, and debris, has been sitting under the skin's surface for quite some time. Its removal promises to be a satisfying spectacle. As the extractor glides across the skin at a controlled angle, the plug begins to rise, revealing a long, intact strand. Dr. Jamie highlights the quality of the technique, the angled application, the even distribution of pressure, and the subtle tension held in the surrounding skin. These combined factors allow the blackhead to release cleanly, without trauma to the tissue. A flush of redness appears where the plug was removed, expected vascular response that indicates the beginning of the skin's natural healing. More blackheads are visible in the surrounding area. The practitioner continues working methodically, and one by one, thick, waxy plugs are drawn from the pores. The skin is gently held taut with each attempt, allowing for smoother extractions. A particularly notable moment occurs when several comedones are extracted from the nasal crease, a region known for its stubborn congestion. Dr. Jamie draws attention to the subtle differences between each pore's response. Some blackheads slide out with ease, while others resist and require a second attempt. None are forcibly removed. Each is treated with patience and precision. This attention to skin feedback is a hallmark of a professional approach. As the practitioner works down toward the nose, Dr. Jamie explains why this region is a common site for congestion. The skin here produces more oil, and the pores are naturally larger. Though viewers may be tempted to extract these at home, the risk of damaging the delicate capillaries around the nose is high. Watching the careful, deliberate extractions in this video underscores the importance of training and experience. The technique remains consistent. Tools are handled with care, and each pass reveals another deep-rooted impaction. The loop is not forced, but guided. One particularly deep blackhead emerges in a long, coiled strand, drawing a gasp from online audiences. Dr. Jamie pauses to appreciate the moment. The rhythm of the extractions becomes almost hypnotic. There's something mesmerizing about watching order restored to chaotic skin. Dr. Jamie speaks to the psychological satisfaction many viewers experience, the relief, the transformation, the sense that something hidden has been revealed and resolved. As the session continues, attention turns to the aftermath. Where each blackhead once lived, a clean pore remains slightly red, open to the air. Dr. MD. Jamie reflects on what's often missing from these videos, the part where the skin is cared for after the trauma. Though unseen here, she notes the importance of treating these areas gently to prevent scarring or infection. By the time the practitioner finishes, the treated area looks dramatically different. The texture is smoother, the congestion visibly reduced. Jamie notes how satisfying the results are, but she remains grounded in her analysis. It's not just about the spectaclites, about the technique, the hygiene, and the respect for the skin's limits. Near the end of the video, Dr. Jamie shifts her focus from technique to emotion. She shares stories from viewers who have written in, describing how these videos help ease their anxiety or bring a sense of calm before sleep. There's something deeply human in watching a problem removed, a wound cleaned, a face renewed. And in that process, viewers find not just entertainment, but comfort. As the video wraps up, Dr. Jamie summarizes her thoughts. This session was executed with care and attention to detail. The extractions were performed cleanly, with good pressure control and minimal skin trauma. While the aftercare wasn't shown, the results speak for themselves. She smiles softly and speaks directly to the audience. What we've just witnessed isn't just a skincare routine, it's a story of healing. Every plug removed is one less source of inflammation, one more step toward healthy skin. I hope you found this as fascinating as I did. She closes with an invitation. If you enjoyed this commentary, I'd love for you to subscribe and join our growing community. I react to videos like these with a professional eye and a human heart. And if you have a video you'd like me to react to next, drop the link below. Let's keep exploring the world of skincare together. Dr. Jamie Lee reacts. Deep Cluster Extraction on Nose and Chin, Part 2. As the video shifts focus, the camera pans slowly across the tip of the patient's nose, revealing a dense cluster of blackheads nestled tightly together. It's a textbook case of chronic congestion in one of the oiliest zones of the face, the infamous T-zone. Dr. Jamie immediately notices the severity, her tone blending curiosity with concern. The extractor tool is repositioned, and the practitioner begins working row by row. It's almost agricultural in nature, each pore producing a tightly packed filament of oxidized sebum and skin debris. Dr. Prusso. Jamie remarks that this level of density likely took years to develop and may be common in individuals who've never had a professional facial. The extractions here are faster paced. 1, then 2, then 5 blackheads are cleared in rapid succession. The rhythm is precise. Jamie praises the assistant's coordination in stretching the skin, while the extractor applies steady, downward pressure. There's a brief pause as the camera zooms in on a particularly stubborn blackhead that refuses to budge. The practitioner readjusts, changes angles, and with a firmer but controlled motion, the impaction finally breaks free. Dr. Jamie leans forward slightly, eyes gleaming. "This," she says softly, "is where skill meets patience." Some extractions reveal multiple plugs emerging from a single poria condition called dilated pore of Weiner. Though rare, Dr. Jamie explains, these oversized follicles can hold an extraordinary amount of buildup. When cleared, the pore may appear crater-like until the skin gradually regenerates. The chin presents a different challenge. The blackheads here are more embedded, smaller, and positioned at tricky angles. The practitioner switches to a smaller loop extractor and works methodically. Dr. Triumphs. Jamie points out how chin extractions often require more finesse due to the skin's resistance and muscle movement. As more plugs are removed, a pattern emerges. Larger blackheads dominate the nose, while clusters of small grainy comedones cover the chin and jawline. Dr. Jamie notes that this distribution reflects hormonal influence, particularly in adult acne patients. Viewers are given several slow-motion replays of the most dramatic extractions. Long, stringy filaments curl as they leave the pore, some stretching nearly half an inch. Jamie calls them textbook examples of mature impactions. Halfway through this section, a spontaneous stream of clear, fluid lymphatic drainage emerges from one of the more irritated pores. Dr. Jamie calmly explains the body's inflammatory response, reassuring viewers that this is not unusual and typically resolves quickly. By the end of the session, the nose and chin appear flushed but cleaner. The skin, once congested and dull, now looks pink and almost polished. Dr. Jamie takes a long look before summarizing. "That," she says, "was a masterclass in precision." She nods approvingly and leans closer to the camera. The third segment of this series begins with a wide-angle view of the upper cheeks and forehead regions, where blackheads often go unnoticed until they gather in clusters. Dr. Plast. Jamie Lee, ever attentive, immediately notes the patchwork of tiny dark spots peppering the area. "These aren't the dramatic, oversized plugs we saw earlier," she says. "But don't let their size fool you. These microcomedones can be deceptively stubborn." The practitioner swaps out the previous extractor for a smaller loop designed specifically for finer blackheads. They begin with the temples and glide systematically toward the center of the forehead, following the natural contour of the bone and hairline. Dr. Jamie highlights the importance of adjusting technique for this region. Forehead skin is thinner and more prone to bruising. Too much pressure here can lead to trauma, so I'm watching for signs of capillary stress. One by one, the blackheads give way each exit, releasing a thin, thread-like core. Some are tinted gray, others white, depending on how oxidized they've become. Viewers get a high-definition look at the consistency of each impaction, and drdoblet.com. Jamie uses this opportunity to explain what causes differences in color and texture, oil composition, time, exposure to air, and skincare habits. As the